Hi, and welcome back to our video on the dose adjustment of meropenem based on serum creatinine levels using the Cockcroft-Gault formula. Meropenem is a commonly used antibiotic, and it is essential to ensure the appropriate dose is administered to avoid adverse effects and ensure optimal efficacy. In our previous video, we discussed the Cockcroft-Gault formula, how it is used to estimate the creatinine clearance of a patient and determine the appropriate dosage for medications that are eliminated by the kidneys, such as meropenem. Let's continue our discussion by taking an example of a male patient that we discussed in our previous video. He was 65 years old, weighed 70 kg and had a serum creatinine level of 1.5 milligrams per deciliter. To estimate his creatinine clearance, we used the Cockcroft-Gault formula and the result was 48.6 ml per minute. Now, we will refer to the Lexicomp and Micromedex recommendations for the appropriate meropenem dose based on this patient's creatinine clearance, which is 48.6 ml per minute. This is the dose adjustment chart from Lexicomp. Okay, according to Lexicomp, the normal dosage in most of the indications is 1 gram every 8 hours, but in some cases, the normal recommended dose may be 2 gram every 8 hours, as in the case of meningitis. As for the creatinine clearance, 48.6 ml per minute, this patient falls into this category of 25 to 50. So, if the usual recommended dose is 1 gram every 8 hours, then this patient should receive a dose of 1 gram every 12 hours. Or in the other case, the patient with meningitis should receive a dose of 2 gram every 12 hours as per his creatinine clearance. Now, according to Micromedex, this is the recommended dosage guidelines for dose adjustment. The recommended dose of meropenem for a patient with a creatinine clearance of 48.6 ml per minute fall into this category of 26 to 50 ml per minute. And that's how the dosing interval of meropenem for the patient should be extended to every 12 hours. According to Micromedex, the recommended dose of meropenem typically depends on the patient's indication. In most cases, a normal dose would be 1 gram every 8 hours. However, for conditions such as meningitis, the recommended dose increases to 6 grams per day, divided every 8 hours. So, in this case, both referencing resources recommend the same dosage adjustment for meropenem. It is important to note that the appropriate dose of meropenem may vary based on individual patient diagnosis, other factors, and the medications the patient is taking. Although various organizations may prefer different resources, the two referencing resources we discussed in this video, Lexicomp and Micromedex, are commonly utilized for dose recommendations and adjustment. And with this, thanks for watching this video on meropenem dose adjustment based on serum creatinine level using the Cockcroft-Gault formula. If you found this video helpful, please like and share it and subscribe to our channel for future updates. Bye.